Good morning, friends. So, we have 3 days to complete biochemistry. In these 3 days, we will try to cover each and every recently asked question, conceptual questions, image based questions, and definitely with the help of mnemonic and the things which can be retained very easily. Yes, so you must have taken printout of these handouts and on one side, as I told you that if you do it on one side, so we will have some space. The purpose to give so much congested handout, as you know that we have some mental image, mental picture. So in exam it will help you to revise. First thing, before the exam you will be very comfortable to revise these small number of pages. Second thing, yes, you will find that it is yes, in exam many times what happens that we do remember that this thing was written and at this page. Okay, so this give mental picture, and if you have a less mental picture for a particular subject, definitely it would be beneficial. So keeping in the mind, yes, I have made these handouts. Now we start with first question and first mnemonic. Yes, if they gave this graph, this is taken from Harper. This question was asked. This graph is for, yes, hexokinase or glucokinase. This is for hexokinase or glucokinase. Yes, any idea, please do reply. If any idea, please do reply. Okay, this is A, this is B. A is for hexokinase or glucokinase. You can easily remember by H for helicopter. H for helicopter. Yes, helicopter. How helicopter flies, you all know that like this. So this is helicopter like this. While jet, how jet flies? Yes, you can see jet flies like this. G for in fact J for jet, but we can pronounce GJ as same to jet. So first, this A is for hexokinase and B for glucokinase. Okay, clear? Now you will find so many questions on hexokinase and glucokinase. Every time when question is asked, we remember concept. Definitely concepts are always beneficial, but sometimes we can make mnemonic of complicated concepts also. Just like helicopter, if you want to travel a short distance, you will use helicopter. If you want to travel a long distance, just like you want to drop a bomb to another country, yes, you will use jet. So hexokinase is having low km and glucokinase is having high km. So most of time you will find that the question are asked on km, and you all have an idea. I will discuss with enzyme in detail that Km is inversely proportional to affinity. Km is, I write here, Km is inversely proportional to affinity. Yes, you will try to save space as much as possible. Okay, and we'll try to write small. Okay, so that we can cover most the topic in the on the same page. It will help us to recall and revise. Okay, so low km, high km, yes, affinity is inversely proportional to km. Low km means high affinity for glucose. Low affinity, high km, so low affinity. Okay, now you all know that you must have seen many Bollywood movies and Hollywood movies that the hero stops helicopter very easily. stop helicopter very easily. Means this helicopter hexokinase can be inhibited very easily even by glucose 6 phosphate. Glucose 6 phosphate inhibit it, while in this glucokinase glucose 6 phosphate can't inhibit it. Yes, glucose 6 phosphate can't inhibit. Now, so for the time being, I say that hexokinase and glucokinase are having two different properties. Yes, I will try to integrate different topics at one place, and you will be surprised that everything is interrelated. And if you remember anything and you integrate it the other thing, it would be very easy to understand. Okay, so I will give you the concept of isoenzymes on the basis of hexokinase and glucokinase. So this is hexokinase, this is glucokinase. Their km value are different, kinetics are different, their affinities are different, their inhibitors are different, their activators are different, their molecular weight are different. So anything may different, but both of these catalyze the same reaction. Both of these convert yes, glucose to glucose 6 phosphate. Sorry, let me make it silent. Yes, glucose to glucose 6 phosphate means glucose to glucose 6 phosphate can be converted by hexokinase and glucokinase. We will discuss in detail. For the time being, they catalyze the same reaction. If they catalyze the same reaction, they are classified in the same group. They are classified in the same group. Yes, you will write all kinases are transferase. All kinases are transferase. You will write like this. Yes, you know there are 6 groups of enzyme previously. Recently, 2 years back, they added one more class, 7 classes of enzyme. First class is oxidoreductase. Any reaction in which oxidation and reduction occurring, that is oxidoreductase. Second class is transferase. If transfer occur between two compounds, that is transferase. So we found that all kinases are transferase. All kinases are transferase. So hexokinase is transferase, glucokinase is transferase. Okay, because all kinases are transferase. Now, yes, so many questions on hexokinase and glucokinase. Now we utilize to solve questions on isoenzyme. What is isoenzyme? Isoenzymes are different form of enzyme, different form of enzymes which catalyze same reaction. Yes, if I say hexokinase and glucokinase are two different form of enzyme which catalyze the same reaction, so you can say hexokinase and glucokinase are isoenzyme. Yes, so hexokinase and glucokinase are isoenzyme. They catalyze the same reaction. That's why they are classified under transferase. So in isoenzyme, this is mnemonic. In S, you may write here. In isoenzyme, two things are same. In isoenzymes, two things are same. First thing is they catalyze same reaction. First thing, Second thing, they are classified in same group. Classified in same group or class of enzyme. Any other thing may be different. Any other thing may be different. Okay, so again I repeat, they catalyze the same reaction. Yes, they are classified in the same group or same class. Yes, any other thing, their physical property may be different, their electrophoretic may be different, their primary structure of protein may be different, their secondary structure of protein may be different, their electrophoretic may be different, their kinetics may be different, their rate of work may be different, anything may be different. Now solve this question which was asked in AIMS and then repeated many times in different entrance exams. Okay, true of isoenzyme. Yes, true of isoenzyme, that is same rate of work. No, rate of work may be different. This is false. Catalyze same reaction. This is true. Have similar kinetics? No, their kinetics may be different, just like Km value may be different. Yes, false. So this can't be the answer. Same quaternary structure? No, I told you anything structure may be different. Yes, false. Electrophoretic may be different, their physical property may be different. Same group of classification. Please do reply answer. What is the answer? Same group of classification used. Yes, I will increase the speed shortly, don't worry. Initially we are introducing how we will proceed in biochemistry, yes, and how we will integrate different things at the same time. Okay, same group of classification used. Yes, this is true. This is the answer. Good. Good. Have similar distribution of organ. They have distribution organ different. This is false. Yes, if I write here hexokinase is present in all tissues. Very good. All tissues, you are giving correct answer. And this glucokinase is present liver and pancreas. Yes, hexokinase is present in most of tissues, all tissues. So their organ distribution is different. Organ distribution is different. So this is false. So we try to understand by hexokinase as helicopter, glucokinase as jet, and when you will solve question many times you will use the same mnemonic, same picture mnemonic, and you will find every time the correct answer. And here I have touched a topic of enzyme, that is frequently asked question isoenzyme. Yes, so I have put in the box. Yes, I have put this in the box, so you will remember this box is very, very important. So whatever very, very important I will keep in the box. Again I am repeating, please try to accommodate all the content on the same page. It would be beneficial for revision. Now this question was asked, they gave picture. This question was asked, they gave picture, and in this picture, yes, you will find that they gave that what is this disease, and they mention that this is orange color tonsil. That is orange color tonsil, and they ask, yes, orange color tonsil, hypertrophic tonsil, orange color is pathognomic of which disease? And the answer was Tangier disease. Answer was Tangier disease. Yes. Tangier dangerous disease. Yes, you can easily remember by Tang. Tang, yes, energy drink, and you all know Tang is most common flavor is orange. Okay, so many times we can make mnemonic by color. We can make mnemonic by color also, taste also, smell also. Yes, yes. It is. Let me restart it again. Actually, it's little bit lagging. Yes, sorry for interruption, but now it would be little bit smoother, I think. So, yes, Tangier disease energy drink. Told you that we can make mnemonic by the smell, by taste, by color. Yes, and I will give you a very important concept by mnemonic formation. Yes, about mnemonic formation. Just like if you have seen the egg, the white color is protein and the inner egg yolk is cholesterol. Egg yolk is cholesterol. We all know, and we avoid cholesterol. Yes, that egg yolk, when you are doing gym, you exercise, you avoid the middle portion, and that middle portion, the color is yellowish color, orange color. Yes, sometime grayish color, orange color, yellowish color, or grayish color. Okay, so look at this. This is, yes, orange color egg yolk. What is the color of this? Orange. If I ask you, yes, Tang, orange, orange color tonsil, this is cholesterol. If I ask you which compound is deposited in Tangier disease, yes, can you tell me? Yes, what is the defect in the metabolism of which compound in Tangier disease? Can you tell me? Yes, this is cholesterol. Yes, defect in the cholesterol. This cholesterol is deposited. That's why the color is this. Yes, you will find that a cholesterol. I have taken cholesterol, this egg yolk, and I will solve many questions by this concept only. Okay, and I told you that egg yolk may be gray color, sometimes gray color, sometimes yellowish color. So sometime in question on Tangier disease you will find other than orange color tonsil they may give gray color tonsil, gray color tonsil. So I will discuss what is the exact mechanism. Yes, don't worry for the time being. Yes, orange color tonsil, Tangier disease, sometime gray color tonsil, cholesterol is metabolism is defective, and Tang most common flavor is, yes, orange color. So I correlated. Yes, before going to next mnemonic, yes, let me ask you the answer of this question. Yes, this question has been asked so many times for last 3-4 years. Yes, every exam is having more or less same question. Thiamine level is best monitored by, please do reply, what is the answer? You all know thiamine is vitamin B1. Thiamine is vitamin B1. Yes, in vitamin B1 is deficient. Yes, B1 is cofactor. Yes, please do reply, answer please. B1 is cofactor for transketolase. Yes, we will discuss in detail. Yes, for the time being, B1 is cofactor for which enzyme? Transketolase. If transketolase is, sorry, if B1 is transketolase, if B1 is deficient, yes, if B1 is deficient, very good, you are giving reply. Yes, B1 is deficient, then transketolase will not be able to work. Thiamine is vitamin B1, B1 is deficient. Yes, if B1 is deficient, transketolase would not be able to work. So there are two methods. Yes, if you want to see thiamine deficiency, we can directly measure thiamine level, or we can indirectly measure transketolase activity. So means you can directly measure thiamine level or transketolase activity. If you directly measure thiamine level, then this is the best. But it is very difficult. Yes, previously most common and was most commonly used or best was transketolase activity. But recently you will find that we have developed this thiamine level can be directly measured by high performance liquid chromatography. Yes, this is given, not given in Harper. Yes, this is given in clinical textbook of Marks. Yes, latest edition. That now we best test is thiamine. Yes, direct measurement of thiamine, that is the best. And if you are confused, sometimes a controversy starts. Yes, then you can simply call Lal Path Lab that I want to get my thiamine level done. They will say, okay, we can do that. It will take few days and it costs around 6,000, 7,000, 8,000. Okay, whatever the price now they are having, I don't remember. Yes, and they will also say that yes, if you want early result, yes, we can do transketolase activity. Means most common. Yes, this question has been asked in AIMS, different entrance exam, MCI exam. Then, yes, this is a favorite question of MCI. Yes, if in fact you will find that if most common question is most common, then the answer is A. If best, answer is B. So, remember this. Whenever a question is being asked again and again, they will give somewhat twist. Okay, and you will keep in mind. Okay, the reason that yes, I am jumping from this to last page of your handouts. Yes, just to explain that how questions are being asked and how you will solve question. Means you will keep your mind open before solving question. Never ever think that every time question is same. Yes, if you do remember, yes, sorry for changing the topic, but at this time is the appropriate time to tell you how they are framing question with different, yes, with slight change the question. Okay, I am jumping to tryptophan. This is an amino acid. Tryptophan is an amino acid. Okay, because we are considering that whole biochemistry should be integrated, so I will discuss in such a way, integrated way, so that in exam no need to think. Yes, you would be habitual to integrate with different subjects, and yes, you will be able to recall without wasting time. Otherwise, what we do, we start carbohydrate, then protein, then fatty acid. Okay, no, everything is interrelated, and I will show you this time. Tryptophan is an amino acid, little bit interesting. Yes, Tryptophan is having this very bulky side chain, very large side chain, very large side chain. This is called bulky side chain. Yes, bulky side chain, bulky side chain. And this ring is called indole. This ring is indole ring. I do remember indole as baby doll. Indole as baby doll. Yes, baby doll में सोने की, you all know. And there are so many fans, sometimes we forget. So I say, even if you remember even a single word, tryptophan, so many fan of baby doll. So tryptophan is having which ring? Indole ring. Frequently asked question. Okay, yes. And this baby doll always remain in limelight. Always remain in limelight means this indole or baby doll or tryptophan absorb light. I will discuss it later. For the time being, we found that 60 milligram of tryptophan, you all know, 60 milligram of tryptophan give rise to 1 milligram of niacin. 1 milligram of niacin. I do remember niacin as Nia Sharma. Niacin as Nia Sharma. Okay, so we will try to include some little bit, yes, vulgar content, or can say sexual content, and it's said that in mnemonics, if these things are included, it makes little bit fun and interesting also. And you all know that Nia Sharma is also famous for physical appearance and also baby doll, so similar quality. Okay, and how tryptophan is converted to niacin, that there are multiple steps, but I have shortened it down. Yes, only important step. We found that tryptophan is converted to 3-hydroxy kinuranin. If you don't remember, it's okay. Just have an idea. This kinuranin is converted to 3-hydroxy anthranilate. There is antramali. Antramali. Yes, you must not be having an idea about Antramali. Antramali was very quite famous at one time, and she was having similar property just like Nia Sharma. Yes, anthranilate. So when I started this mnemonic, I was not aware that these things will correlate their self, but they started correlating. Okay, so Antramali, here Antramali, yes, anthranilate. We found that this anthranilate is converted to niacin. So baby doll, Antramali, Nia Sharma. Okay, so you will remember. And so many fans are there. So many fans are there. Sometimes they are trapt. In Hindi, trapt ho gaye hain. Okay. Yes. Now we found that this conversion require enzyme. There are multiple steps, but I have skipped only those steps which are required. There is an enzyme kinuraninase. If this enzyme is deficient, yes, then this hydroxykinuranin will not be converted to anthranilate. Then kinuranin is converted to xanthuranic acid. We found that cofactor for this enzyme is pyridoxal phosphate, that is vitamin B6. That is vitamin B6 is cofactor. So B6 deficiency, if B6 deficiency, xanthuranic acid will increase. Again I repeat, normally indole ring tryptophan is converted to this antramali to Nia Sharma. Yes, even if you don't remember the exact name, don't worry, you will find that yes, in exam they give MCQ, so you can easily mark the answer. Nia Sharma, yes, that Nia Sharma is B3. Niacin is B3. Okay, page 3 model. Okay, yes, B3. Now this B6 is deficient, then xanthurenic acid is increased. I am little bit slow. I know that this is rarely read topic. Yes, why I am so much concerned about this, you will realize shortly. Yes, yes, we found that normally tryptophan is converted to serotonin. Question is asked. Yes, what is the precursor for serotonin? Precursor for serotonin is tryptophan. Serotonin is further converted to melatonin. So precursor for melatonin is tryptophan. Remember this point. Precursor for melatonin is also tryptophan. Precursor means at the level of amino acid. So serotonin, melatonin, tryptophan. Now we found that in our body serotonin is converted to 5-HIAA. What is 5-HIAA? Sometimes they don't give HIAA, and then sometimes they give hydroxy indole acetic acid. And whenever you will find the word indole, yes, you will immediately think that this is baby doll related, means HIAA, tryptophan converted to serotonin converted to HIAA, indole ring is there. Clear? Now, so now I can say you tryptophan. Question is asked. Tryptophan is a compound. Tryptophan is a sub precursor for serotonin. Yes, precursor for serotonin. It is precursor for melatonin. It is precursor for niacin. Yes, it is intermediate compound is antramali. If B6 is deficient, then this step will not occur. Niacin deficiency would occur and kynurenine will increase. That will form more and more xanthurenic acid. Clear? Yes, if there is a disorder in medicine, surgery, in fact, yes, many times you will find carcinoid syndrome. Carcinoid syndrome. Carcinoid syndrome. In carcinoid syndrome, you will find that more and more tryptophan is converted to serotonin. In carcinoid syndrome, more and more tryptophan is converted to serotonin, and if more and more converted to serotonin, yes, tryptophan will not be converted to niacin. So now we can say niacin deficiency. Now you will say niacin deficiency lead to pelagra. Yes, I don't tell you the meaning. You understand, some of you, pelagra. Yes, and this word spontaneously is correlating with these Nia Sharma and yes, baby doll. Okay, pelagra, that is 3D. Symptoms are 3D: diarrhea, dementia, dermatitis. Okay, dementia, diarrhea, dermatitis. Dermatitis, you will find the patient is having typical dermatitis. There is a typical castle neck appearance. Typical which appearance? Castle neck appearance. Castle neck appearance. Yes, gale ka haar, castle neck appearance. Yes. So this question has been asked many times. They give the same picture, same symptom: B3 deficiency, niacin deficiency, pelagra. But this niacin deficiency, there may be multiple cause. There may be multiple cause. One cause is you are not taking tryptophan in diet. Means tryptophan is normally converted to niacin. If tryptophan is not there, niacin would not be there, and there would be symptom of pelagra. If tryptophan is being converted again, more and more converted to serotonin, just like carcinoid syndrome, patient may present with pelagra. If there is heart nerve disease, sorry, I am complicating, I know few of you are little bit worried. Are you getting these things? Please do reply. Heart nerve disease, heart nerve disease, yes, it is autosomal recessive. Mnemonic, heart nerve, yes, AR, autosomal recessive. T4 tryptophan, NU4 neutral amino acid absorption is defective. In heart nerve disease, tryptophan and neutral amino acid absorption defective in intestine and renal tubule. Intestine and renal tubule. So tryptophan deficiency again present to pelagra disease, pelagra like symptom. Now, so heart nerve disease may have pelagra like symptom, carcinoid syndrome may have pelagra like symptom, B3 deficiency may have pelagra like symptom, and if B6 is deficient, then tryptophan is not converted to niacin, again pelagra like symptom. So now look at this. This is the question which has been asked so many times, in your exam. Okay, yes, sorry, yes, typical castle neck appearance. This is typical castle neck appearance. If you see, this is typical castle neck appearance. Okay, clear? This diagram is given in most of the question in MCI, AIMS. Every time they are giving same question. Now I say the same picture is here and they gave this question, and please tell me the answer. Yes, now you have read each and everything. Now I explain how they are asking question. A person presented with diarrhea, dermatitis, dementia, typical castle neck appearance patient may have. If this question is asked, what is the answer? Please do reply. Same question, yes, what is out of these four are given, one to choose. Please do reply. Yes, A. You marked answer A. Very good, very good. In the same question, if I give that, yes, very good, yes, you are giving correct answer, yes, very good. In the same question, if I add there is increase HIAA, means in the same question if they added increase HIAA, haya, so no haya, no sharam, no haya, yes, baby doll, Nia Sharma, Antara Mali, so much of haya, okay, and car scene, yes, PK, you must have seen the movie PK, the scene of car, yes, that is shaking car, okay, haya, Nia Sharma, in baby doll, everything is correlated. I don't know why it is correlated, it's a natural thing, okay. So yes, if in the same question they added this HIAA, Yes, the answer would become carcinoid syndrome. What does it mean? Means if HIA is increased, means more and more tryptophan is converted to serotonin, no extra tryptophan to make niacin, pelagra like symptom. Clear? In the same question, yes, if B6 is deficient, then this tryptophan will not be converted to niacin. Yes, tryptophan will not be converted to niacin, and xanthurenic acid will increase, xanthurenic acid urea. So in the same question, in place of HIAA, they gave increased uranic acid. What would be the answer? Please do reply. What would be the answer? B6 deficiency. B6 deficiency. Clear? In the same question, they gave, yes, very good, Shashi. In the same question which they gave, there is defect in absorption of tryptophan. Defect in the absorption of tryptophan. Very good. You are giving correct answer. In intestine and renal tubule. Then answer would become Hartnup disease. So the purpose to tell you in this way is that they are asking the same question again and again. Doesn't mean that you are surprised why they are asking so simple question. No, it is a common complaint of students that when we remember, we match the recall question, we get a little bit extra mark, but actually when we find the result, there is always less mark. The reason is that whenever we see this picture, without second thought, we mark the answer B3. No, just point out if they have given anywhere the word HIA. Although they should give all the symptom of carcinoid syndrome, just like flushing and all that, diarrhea, or diarrhea is common to that, but in other symptoms are also there. Okay, carcinoid syndrome. Okay, but they are asking you biochemically, so they will not give symptom. They will give simply a word HIAA, and they will ask what is the answer. They will give xanthurenic acid. What is the answer? They give defect is autosomal recessive disorder. If they give the person is having autosomal recessive disorder, the answer would be this. And sometimes, rarely asked question, but I would like, when we have discussed, once or twice this question has been asked, that is blue diaper syndrome. Okay. Yes. If tryptophan absorption defective in intestine only, it was both intestine and renal tubule, both tryptophan and neutral amino acid, only intestine, then it is blue diaper syndrome. Okay, and you know the blue word is related to this baby doll. Yes, sometimes we don't want to tell these types of mnemonic, but sometimes we find that when I started this mnemonic, I never thought that in this metabolism, every character of our Bollywood would be there. Carcine, PK, Haya, so many fan art. Trupt, Baby Doll, Nia Sharma, Antara Mali, Maruti Jain, Janthuranic acid, Maruti Jain. Yes, heart nub. When you see these types of movie, your heart nubs. Okay, blue diaper. Everything is related. And this is a pure coincidence. And yes, I found, yes, so many. Yes, I am also human being, being a doctor, teacher. Yes, sometimes ओ बेटे मौज कर दी. मौज मतलब मजे, मजे, मेज, मेज, corn. Yes, and it's not porn, it is corn, maize corn. If you see more, if you eat more maje and porn, yes, there is niacin, there is, yes, pelagra like symptom. Because maize and corn, yes, are deficient in tryptophan. Corn cause tryptophan deficiency. Question has been asked on maize. I want your comment, yes, how this mnemonic was and how this integration was. Okay, because I never thought these types of mnemonic I will made. I am not this type of personality, but when I found every time, yes, these things, so it was spontaneous. Okay, and these are frequently asked question. Yes, this is frequently asked question recently. Actually, I analyzed the question paper. As I told you that I prepared again twice in my life, and second time I was preparing, yes, second time PG when I entered in MD psychiatry. Before that, I was analyzing the pattern of paper, how they are asking the question and what is the pattern of exam, and that's the reason I cleared my entrance exam in 5 month preparation only. Okay, all India general rank. Okay, the reason is, I'm not saying that I'm the very intelligent person, but I do plan. Okay, so if you plan, you analyze, yes, you will perform better. Okay, yes, so these are the few questions. I leave this mnemonic for later. Now we start conceptual thing. Okay, we start first topic. Okay, this was introduction. Now we start first topic, carbohydrate. Yes, you have space. Carbohydrates. As usual, initial few 1 hour I take in mnemonic and pattern. Yes, carbo means carbon, hydrates means water. Carbo means carbon, hydrates means water, CH2ON. This is the empirical formula of carbohydrate. This is empirical formula of carbohydrate. So C6H12O6 is prototype, that is glucose. I can increase the speed. Can I increase? Yes, please do reply. Glucose, fructose is C6H12O6, mannose is C6H12O6, galactose is C6H12O6. Yes, these are the compound glucose, fructose, mannose, galactose. They are having same molecular formula, and different compounds having similar molecular formula are called isomers. So they are isomers. Glucose and fructose, mannose and galactose are isomers. You must have idea about the structure of glucose and fructose. So many questions on this structure. Yes, glucose. Yes, if you see the structure of glucose, this is C1, C2, C3, C4, C5, C6. At least 15 to 20 question on the structure of glucose itself. In glucose, at carbon number 1 there is aldehyde group. Carbon number 1 there is aldehyde group. At carbon number 2 there is keto group. Fructose is having keto group at carbon number 2. Glucose is having aldehyde group at carbon number 1. That is why glucose is called aldose sugar, while fructose is called keto sugar. Means glucose and fructose, they are having same molecular formula but different functional group. Functional groups are different, that's why they are functional isomer. Functional isomers. So glucose and fructose are functional isomer because they have same molecular formula but their functional groups are different, functional isomer. So question was asked, fructose is functional isomer of glucose. Okay, now if you see the structure of glucose, it is having OH, 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 OH. 5 OH are there. Each and every point is question. So glucose is having 6 carbon and 5 OH. So we found that 5 OH are there, and wherever you find the compound is having OH, you will say compound is polar. Yes, first statement, yes, you can write here. Any compound having OH is polar. Okay, any compound which is having a polar. So glucose is a polar compound. Wherever you find OH, OH has tendency to attach with phosphate. OH group has tendency to attach with phosphate. Yes, so you all know glucose 6-phosphate, fructose 6-phosphate is quite common because glucose 6-OH is there, fructose OH is there, means wherever OH is there it can attach to phosphate. Clear? Now I change the topic, means I am going to amino acid. Yes, integration. Wherever you find OH, this can be attached to phosphate very easily. So we found that in proteins there are 20 amino acids which take part in protein synthesis. How many amino acids are there? 20 amino acids. Now recently we say 21 amino acid. So 20 amino acids are common. Out of those 20 amino acids, 3 amino acids are there which are having OH, and mnemonic for that is OH. Yes, I make a box so that just to tell you, just to point out that this is a different topic. OH, try 3 sari, 3 sari try karo, try 3 sari. Okay, OH means OH containing amino acid, try means tyrosine, 3 means threonine, sari means serine. So if I ask you, these amino acids are polar or non-polar? These amino acids are polar or non-polar? These are polar. There is controversy about tyrosine. For the time being, you consider it polar. Okay? Means wherever you will find OH group, compound is polar. And you all know, whenever there is OH group has tendency to attach with phosphate. So serine has tendency to attach with phosphate, threonine has a tendency to attach with phosphate, tyrosine has tendency to attach with phosphate. Okay, so wherever you find OH, OH group has tendency to attach with phosphate. So which amino acid has tendency to attach with phosphate? Serine. What was the question? Yes, I am writing here. Yes, I am writing here. If you have space, so question. Yes, I told you that to take printout on one side. The reason is that yes, you can add on the yes relevant topic with relevant topic question. Yes. Okay, if you don't want to write, just listen and you will appreciate. An experiment was going on. There was a protein. Protein was made up of 200 amino acid. In this experiment, we were replacing amino acid. And in this experiment, 190 amino acid valine was replaced by another amino acid. Again, I am repeating that there was a protein having 200 amino acid, and experiment was going on, and in this we were replacing amino acid, and in this 190 amino acid valine or alanine replaced by different amino acid. After this replacement, this protein was found high tendency to be phosphorylated. High tendency to be phosphorylated. Which amino acid, the new amino acid is present in new protein after change? Option A, valine, aspartate. Right? Option A, leucine. Option B, lysine. Option C, serine. So answer would be, yes please, A, B, C. What would be the answer? Please do reply. Means an experiment was going on, valine was there at 190 position, and this was replaced in amino acid. Now the protein started having a tendency to attach with phosphate. Very good. Sashi, good. Good. Only two answer. Yes, the answer would be yes, serine. Answer would be serine. Good. Answer would be serine. So these three amino acid are phosphorylated easily. Clear? So this is now. Let me. Yes, good. Good. Now yes, so I tried to, yes, I have opened the YouTube channel also. Yes, Bilal Ali, and yes, so initially I was not aware about yes, now I can reply also your doubt. Okay, yes, so now we move to, yes, so this is carbohydrate, and I integrated the OH of carbohydrate with O tri 3 sari. Okay, yes, now this is fructose is keto sugar. If I ask you, this keto group is present at C1 or C2? Keto is at C2. Name itself tells you keto 2. Keto at 2. Okay, clear? At 2. And aldehyde at C1. I will ask question. Yes, for the time being, any carbohydrate which is having 5 or more than 5 carbon acquire a cyclical structure. You will see DNA and RNA. When I will discuss DNA and RNA, at that time I will tell you the pentose sugar, ribose sugar, deoxyribose sugar, and whenever you have read that pentose sugar is always written in a cycle form. means any carbohydrate which is having 5 or more than 5 carbon acquire a cyclic structure. Clear? So glucose acquire a cyclic structure, and this is glucuronic acid or glucuronate. Now I am telling you a very important concept. If I write acetic acid, that is CH3COOH. Acetic acid ionize. Yes, acetic acid ionize to form CH3COO minus. CH3COO minus, and now we say it is acetate. So whenever in complete biochemistry you find carboxylic group, it will ionize to acquire which charge? Negative charge. But in question purpose, if I say acetic acid and acetate are same, having 2 carbon and having negative charge, if I ask you how many charge acetic acid is having, you will say it is having 1 negative charge. Yes, how many carbon it is having, you will say 2 carbon it is having. Acetic acid, acetate or acetyl coenzyme are same. Okay, I write here acetyl coenzyme. For question purpose they are same, having 2 carbon. Okay, now in the same way, if I say glucuronate, all glucuronic acid are same. Iduronate or iduronic acid. So never ever get confused with the complicated thing that yes, you say to remember this is glucuronic acid, this is glucuronate. No, they are same, having which charge? Negative charge. So wherever you find carboxylic group, it will ionize to acquire negative charge. Now they are asking question on the structure. When they are asking question on the structure, you will find that if they give this structure, this is glucuronic acid and this is iduronic acid, you can easily recognize by inside the ring. If acid is inside the ring, I4 inside the ring, then you will say it is iduronic acid. Okay, outside the ring, glucuronic acid. You have an idea. Okay, but that's sufficient. Even if you don't remember, it's okay. Now I am going to some clinical part recently asked. Okay, and most difficult part they were asked now in AIMS and then many entrance exam. Okay, whatever has been asked in AIMS recent. Okay, glycosaminoglycan mucopolysaccharide or heteropolysaccharide. Yes, Anik, I have asked concerned team, they will take care of that. Okay, don't worry. So whenever you will find heteropolysaccharide or mucopolysaccharide, you will find acidic sugar, and I have told you acid, that is COOH. Acid means COOH. Amino sugar, amino means NH2, amino sugar. So even if you don't remember, just remember one is acidic sugar, one is amino sugar. Acidic sugar is uronic acid, amino sugar, yes, or iduronic acid. Amino sugar may be glucosamine and acetyl glucosamine. Even if you don't mark up, it's okay. One acidic sugar, one basic sugar, and in mucopolysaccharide they have sulfate. And this is polymer. Yes, N means multiple unit of these 2 unit, heteropolysaccharide, mucopolysaccharide. Why they are called mucopolysaccharide? We found that these are 6 type. Okay, heparin sulfate, hyaluronic acid, chondroitin sulfate, dermatan sulfate, creatine sulfate, all are heteropolysaccharide and all are called mucopolysaccharide. Why they are called mucopolysaccharide? Because when they absorb large amount of water, they form mucus structure. What is mucus structure? See, that is mucus structure. Now you understand. And mucus structure is slippery in nature. And what is the purpose? Nature kept all these mucopolysaccharide in that area of body where shock absorption is required. Just like you are running. When you are running, you have two bones, and in between two bones there is synovial fluid. We found that in this synovial fluid there are so many mucopolysaccharides. They have sulfate group. They have which group? Sulfate group. And sulfate is having negative charge. Sulfate is having which charge? Negative charge. So when these sulfate groups are there, negative charge are there, due to negative charge they repel each other. If a pressure comes bone, that this bone comes, pressure comes, they want to strike. But you know the rule, when the two negative charge to positive charge come closer, the force increases exponentially. So as they come closer, the force increases, means these bones never strike because of this synovial fluid. And in old age, when this synovial fluid is depleted, decreased, then these two strike osteoarthritis. So these are present in extracellular tissue. Why? What I said? All heteropolysaccharide they absorb large amount of water to make mucus structure, slippery structure. They act as shock absorber and they prevent this damage, and they are extracellular, not inside the cell. They are outside the cell, synovial fluid. Okay. Now we found that out of these only one is intracellular. Again I say, yes, if you search only a single word, means each and every word would give you some idea. Just like, yes, heparin, in for intracellular, in for intracellular. So heparin is intracellular. Clear? All other are extracellular. You must have read in pathology medicine that mast cell is having heparin. Okay, question. So all are extracellular except heparin. Clear? Now, yes, so we found sulfate. I told you so many. What is the composition? I am going to tell you. But yes, before that you will remember the mnemonic. Whenever a structure of mucopolysaccharide, heteropolysaccharide is given, the first step, yes, I write here, space is there. First step, see or search for sulfate. Each and every mucopolysaccharide is having sulfate, I told you, except hyaluronic acid. Yes, except hyaluronic acid. All others are having sulfate. So now, yes, let me explain. Yes, look at this. If a structure is given, if we don't know which structure is this, we don't know. First step you will do, mucopolysaccharide is there, you will search for sulfate. Sulfate is there, it can't be hyaluronic acid. Sulfate is there, it can't be hyaluronic acid. Sulfate is there, it can't be hyaluronic acid. No sulfate. Yes, no sulfate, hyaluronic acid. Yes, the same question was asked, simplest question. Yes, if you see 20 years. Yes, I am teaching biochemistry since 2007, 7 last or 8. Okay. Yes, I have gone through each and every question, the pattern changing day by day. Yes, you will find that this was the favorite question of MCI aims, that which of the glycosaminoglycan is not having sulfate. What they did, same question in the picture form. Same question in the picture form. In this no sulfate, answer is yes. Please do reply. Anmol has given answer initially. Yes, from yes, Behtareen Bhatia, please do reply. What is the answer? What is the answer? Hyaluronic acid, no sulfate. Okay, good. Yes, now second rule. Good. Second rule. Yes, Anik, good. Anand, Shashi, Pancholi, good. Second rule, search for C4 acid or uronic acid. Yes, just to make mnemonic, acid, keratin sulfate, no uronic acid. Yes, no acid in fact. Yes, I made this mnemonic. Yes, every time try to make some mnemonic. Just like जहाँ पे भी कीर्तन होते हैं in Hindi, sorry for English person. Yes, जो who can't understand Hindi, I will explain. जहाँ पे भी कीर्तन होते हैं वहाँ पे तुम पेशाब नहीं करते. Yes, I made this mnemonic. There are beards, but I do that like that. So if you are doing worship, kirtan are called worship in Hindi. Yes, we never urinate there. No uronic acid. So keratin or kirtan for worship. Okay, no uronic acid. No urinate means no acid. Yes, let me explain with the help of example. Yes, with the help of example. Yes, our wines. Shahjad, good. Yes, sorry. In this, yes, if I ask you, yes, leave it. If I ask you, this is the structure, acid is there, it can't be keratin sulfate. Acid is there, it can't be keratin sulfate. Acid is there, it can't be keratin sulfate. Yes, now look at this. No acid. Answer is keratin sulfate. So 2 point, if you will remember, then you will find the answer. Why I am not? Previously I also made the mnemonic for heparin and chondroitin, dermatin, everything. But later on I found that they should not ask that question. The reason is that in suppose I say heparin sulfate or heparin is having hydronic acid. I used to say like this, but many times you will find that the composition of heparin may vary. Okay, predominantly hydronic acid, but doesn't mean that it can't have uronic acid. So that's why they will not ask question on that. They are trying to check your knowledge, how you will differentiate, how you will solve question, or how you will solve clinical aspects. Okay, now what are the questions on these glycosaminoglycan? Just like hyaluronic acid is present in synovial fluid, it is very frequently asked question. Yes, doesn't mean that hyaluronic acid is not present anywhere. It is present in skin, bone, cartilage, loose connective tissue, means wide distribution. Hyaluronic acid is also present in vitreous humor of eye. Yes, eye is having two compartment, posterior compartment. Yes, posterior segment is having vitreous humor. Vitreous humor is rich in hyaluronic acid. Yes, keratin, name itself tells you, keratoplasty means of surgery or cornea. Yes, kerato means cornea. Yes, cornea is a part of eye. Yes, keratin sulfate is present in eye. So you will be surprised that in our cornea, yes, whatever black area you are saying, that is cornea. Yes, black area, in fact, if you go deep, cornea is transparent. Cornea is transparent. That's why you are able to see the pupil and the iris. So cornea, yes, is transparent, and you will be surprised that collagen is a protein. Collagen and keratin sulfate are arranged in our cornea in such a way that it is transparent. What I said, it is transparent due to this keratin sulfate. Transparency question was asked recently, that corneal transparency is due to keratin sulfate, okay, which contribute to corneal transparency. A question has been asked in MCI itself, that which of the following glycosaminoglycan combination of two are present in eye. So this is present in eye, this is present in eye. So hyaluronic acid and keratin sulfate are present in eye. You can easily remember dermatan sulfate skin, derma skin. Chondroitin sulfate, chondro word is used for cartilage. So cartilage, bone, CNS. So it is widely distributed. Now, so these are the common question, their distribution. Yes. Now, we found that this keratin sulfate, dermatan sulfate, hyaluronic acid, these glycosaminoglycan are distributed extracellularly, and they are metabolized in cell and in lysosome. What I said, in lysosome. These are metabolized, these mucopolysaccharides are metabolized, they are degraded, or you can say metabolized or degraded in lysosome. Lysosome is having enzyme hydrolase. Yes, hydrolase. Hydrolase is enzyme which cut a bond, with addition of water. Means when you want to cut a bond and you add water, means you are cutting a bond with the help of water, then it is hydrolase. The name itself tells you hydro word is water, lase means cutting, cut a bond with addition of water, hydrolase. So there are so many hydrolase in lysosome, so many types of hydrolase. If hydrolase is deficient, then these mucopolysaccharide will not be degraded and they will accumulate. And when they will accumulate, then mucopolysaccharide accumulate. That's why this is called mucopolysaccharidosis. Mucopolysaccharidosis, right? Dosis, MPS. As you know, mucopolysaccharides are widely distributed. Yes, liver, lung, skin, yes, synovial fluid, bone, cartilage. Yes, means everywhere they are distributed. So we found that yes, mucopolysaccharide have common features. All mucopolysaccharide, I will discuss one by one. Mucopolysaccharide type 1, 2, 3, 4, 6. Okay. So all mucopolysaccharidosis, yes, have more or less common symptom. Only one or two are different, and on the basis of those 1 and 2, we make the clinical diagnosis. In exam questions are asked. So how you will differentiate, I will tell you. Yes, most of the mucopolysaccharidosis present with coarse facial features, just like large tongue, okay, thick lips, flat nasal bone, Frontal bossing means large frontal head. It is present in bone, accumulate in bone, large frontal bone, frontal bossing, depressed nasal bridge. Yes, tongue is large. Okay, and this is a lips large means coarse facial features. Okay, as I told you that creatine sulfate is responsible for the transparency of cornea. If this creatine sulfate is deposited extra, then there may be corneal clouding or ossification, opaque. Okay, moderate corneal cloud opacification or corneal clouding word also use corneal clouding. Okay, other than that, it will deposit in bones also, and bone will be in bullet shape. Yes, bullet shaped middle phalanx. Yes, bullet shaped middle phalanx. Okay, this is bullet shaped middle phalanx. Clear? So this mucopolysaccharide may present these types of symptoms. Now I discuss one by one. Mucopolysaccharidosis type 1. Type 1 is not, is it clear? Yes. It may be of Hurler type or She type. In mucopolysaccharidosis type 1, there is deficiency of iduronidase. Enzyme is deficient. If this enzyme is deficient, complete deficiency or partial deficiency. So in question you will find that if iduronidase is completely deficient, then Hurler disease. If it is partially deficient, then She disease. Okay, if iduronidase is completely deficient, then yes, there would be mental retardation. Means, in fact, in all mucopolysaccharidosis, I told you there would be deposition of mucopolysaccharide at different cell, frontal bossing, large tongue, thick lip, nasal bridge, depressed nasal bridge. There would be hepatosplenomegaly. When hepatosplenomegaly will be there, protuberant abdomen will be protuberant. There would be musculoskeletal symptom, that muscle would not be well developed, hernia may be there. Okay, they will deposit in brain, mental retardation would be there. So corneal opacity would be there, finger, bones, middle phalanx, blood shaped middle phalanx may be there. So means multiple symptoms may be there, but yes, we found that they will give in the question about the enzyme, and they will give iduronidase is deficient and patient present with MR. So in that you will immediately think of Hurler disease. But if say iduronidase is deficient, they don't mention it is partial or complete, and no mental retardation, immediately you will think of She disease. Clear? So this is type 1 mucopolysaccharidosis. Type 2 is Hunter's disease. For type 2 you will remember this Hunter diagram. You must have seen many Hindi movies. In Hindi movies, yes, there is a villain, and yes, bungalow. In bungalow there are two guns and face of lion. Okay, face of lion, that is the typical hunter in Hindi movies, yeah, or Bollywood movie, Tollywood movies. Hunter means yes, lion and two gun. Yes, two guns means MPS type 2. These guns are like this cross, so this is X-linked recessive. Hunter's disease type 2, MPS type 2 is X-linked recessive. All others are autosomal recessive. MPS type 2 is X-linked. So X hunters. Yes, if you are going for hunting, yes, mostly hunters are male. Mostly hunters are males, more common in male than female, you all know. Yes, डाकू हसीना तो एक दो ही होती है, बाकी सब मेल हंटर्स होते हैं. Okay, yes, and you will find that if you are going for hunting and your vision is not clear, yes, I told you most of the mucopolysaccharidosis have corneal opacification. But if you are going for hunting of a lion and you are not having a good vision, you will not be able to hunt. In fact, you will be hunted, okay, by lion. So a hunter should have very good vision. So no corneal clouding. No corneal clouding, Hunter's disease. So I write here Hunter's disease. Yes, in this which enzyme is deficient? Iduronate sulfatase. Iduronate. Why I have written here, you will appreciate shortly. Iduronate sulfatase. Yes, each and every location do have significance. Yes, this is well planned. Okay, why I have a MPS 1 only one word enzyme is deficient, MPS 2 two word enzyme deficient, means they are similar words. Iduronidase or iduronate sulfatase are quite similar, but you will easily remember one word MPS type 1, two words MPS type 2. Okay, now yes, type 2 X-linked, this is the hunter. Okay, you will remember. Now please do reply the answer of this question. Yes, yes, on both YouTube and my Behtareen Bhatia. A 12-year-old intellectual disabled boy having short stature. Yes, I told you, short stature, protuberant abdomen, umbilical hernia, prominent forehead, all are common in all mucopolysaccharidosis, and vision is normal. Alphase, please do revise your answer. Yes, means his vision is normal. No corneal clouding, means MPS type 2. Yes, GDK alphase, good. Yes, iduronate sulfatase. Okay, iduronate sulfatase, good. Anik, yes. Dr. Neela Ba, yes, good. Yes, so iduronate sulfatase, vision is normal. Yes, so this is a neglected topic previously, but recently that is Karthik, thank you. Yes, very good answer. Yes, but now they are started asking, and most of time you will find question on these two things. Okay, sometimes yes, they can ask few more question. San Filippo is most common single liner, particularly in MCI. This is MCI. Yes, MR would be there. In mental retardation would be there in Hunter's disease. Okay. Okay, most of these are having mental retardation. Yes, all the symptoms may be common. Just like I pointed out. Yes, in she disease no mental retardation. Specific point. San Filippo, MCI favorite question, most common mucopolysaccharidosis. More Q syndrome type 4. Yes, I do pronounce it like that. More IQ. More IQ. Pronunciation means no mental retardation. Question. So you may find the clinical question in which no mental retardation, and the significant point would be yes, this mental retardation, and answer would be MCQ. Okay. Yes. So I have discussed this. So I will not give you extra burden, put you extra burden, which are frequently asked question and which can be asked in future. I will touch that only. Otherwise, mucopolysaccharides Sanfilippo itself is of multiple types. So to put energy, yes, we should be wise enough. Being a psychiatrist also, yes, I know that how to plan your life is not only just hard work, it is the planning that where you should invest your energy. Sometimes we use, yes, it's good to learn new thing, but at this time the priority of time is, yes, priority need of time is that you should remember only the relevant thing. That's why I am skipping the detail of all other mucopolysaccharides. Yes. Now I am going to start glycolysis. So hope you have enjoyed this part. Yes, this is the most difficult topic, and when questions are asked, students get confused. No need to have fear of these difficult structure. Yes, all, and again I repeat, you must not forget the structure of glucose and fructose. I will solve 15 to 20 questions on this structure only. Okay. Glucose is having aldehyde group at which carbon? Carbon number 1. Fructose is having keto group at which carbon? Carbon number 2. Keto group at C2. Okay. Now this mnemonic, okay, let me complete this mnemonic also. This is left, otherwise I will feel, or you will feel not. Yes, let me complete. Yes, rhyme method of mnemonic. Rhyme method of mnemonic, yes, is do remain connected with my Telegram group. Yes, I am doing work on the mnemonic of different subject, pharma and micro. Okay, so that you can get benefit of that. Yes, I can make mnemonic because I am working on that. Yes, this is my project. Okay, that to how to improve the artificial memory. You have two types of memory. Yes, one is the true memory, true beauty. Yes, if you see the girl, that true beauty sometimes so natural. Okay, and after makeup, yes, you must have experienced and so many jokes on Facebook. Yes, when they got married, she was so beautiful, and after that, when makeup, yes, is removed, everything is changed. So in the same way, sometimes we don't have a very good memory, but we can improve our memory by this makeup, and makeup is nothing but mnemonic. Okay, I will tell you, don't worry, Dharmesh. Okay, yes, so yes, so makeup improve our memory. Yes, in the same way, mnemonic improve our memory. Yes, just like makeup improve our beauty. So there are so many techniques. Yes, being a psychiatrist, I am fortunate to get this branch. Deliberately I took, I know, but yes, now I'm feeling fortunate that I can understand what is human behavior and how we can improve ourselves. Okay, so one way is to improve our memory, and that can be done by mnemonic. So many technique. One is rhyme method, just like Farber disease, also called Barber disease. Okay, so I remember Farber as barber. Yes, and barber cut hairs of sir in Hindi. Sorry for that, who can't understand Hindi, but barber sir ke baal काटता है. So yes, Farber disease, ceramidase. Which enzyme is deficient? Ceramidase. And एज मतलब कट करना. एज मीन्स कट करना सिर के बाल. If a farmer is cutting hair since morning to evening, a farmer is cutting hair since morning to evening, his fingers will be having pain. Joint pain in small joint pain, swelling is there, and you all know rheumatoid arthritis. Yes, rheumatoid arthritis. Yes, I will write this group name, don't worry. Okay. Rheumatoid arthritis, rheumatoid arthritis. Yes, this is rheumatoid arthritis, small joints are involved. So when they ask question, you will find Farber disease, Fabry's disease, yes, sphingomyelidosis means Niemann-Pick disease, hexosaminidase deficiency, that is Tay-Sachs disease. In these, more or less symptoms would be there, but few specific symptoms are there by which you can solve the clinical question. They will give multiple symptoms, and they will give a patient is having joint pain just like rheumatoid arthritis, and immediately you will mark the answer Farber disease. If Farber is cutting hair since morning to evening, small joint pain, Farber disease, Barber disease, ceramides deficient. Why I am concerned about this mnemonic? Yes, why I make? Because starting for F, Farber disease, Forbes disease, Fabry's disease, three diseases are there having similar name: Farber, Forbes, Fabry's. We will discuss later. For the time being, Farber is Barber. Now we start glycolysis. Means glucose enter the yes cell. Now we do glycolysis. Yes, before glycolysis we can do two things. Either we can directly jump to glycolysis, or we can make a conceptual map. Yes, if you have one blank page, so we can make a conceptual map here. Yes, if you have blank page, I do have so much of space, I know, but you must be having. So I am giving the framework of all these things, how the metabolism is occurring, and when you will understand, then there is no need to mug up which pathway, which enzyme is activated by insulin, which is inhibited by glucagon, which is extracellular, which is found in, which reaction is occurring in cytosol, which is occurring in mitochondria. No need to muck up. Just remember this flow chart and you will remember. Okay, so I start making this. Okay. Yes, when we take diet, you all know in diet we have carbohydrate, we have lipid, we have protein. We found that whatever diet we take, maximum content is carbohydrate. 60-70% of our diet is carbohydrate, 15-20% is lipid, rest is protein. So maximum content is carbohydrate. So carbohydrate has so many functions. One means you are taking carbohydrate in such a large quantity, so it must be having multiple purpose. But whenever carbohydrate comes in our mind, glucose comes in our mind, and we immediately think about glycolysis, Krebs cycle, and energy production. Definitely the main function of carbohydrate is energy production. Yes, one carb function is energy production, and that is done by glycolysis. Means glycolysis, what is glycolysis? I write here glucose to 2 molecules of pyruvate, Yes, glycolysis is for the time being. Yes, you must be having a little bit idea what is glycolysis. Glucose enter the cell. Glucose is metabolized by multiple steps, and two molecules of pyruvates are there. Glucose is having 6 carbon. You all know, we have already discussed. Glucose is having, yes, I will move here and there just to recall you and make you recall, and trust me, this is the best way to for study. When you are doing your work, means you are reading any subject, try to move from one place to another. Yes, suppose a word comes in your mind, immediately you think that okay, this word I have read earlier in pathology, so it may take your 2-3 minutes, but open that notes and this will integrate. After 4-5 days, your mind would be trained to correlate spontaneously. It would come in reflex. And I want that my students get all these things integration in reflex. So glucose is having how many carbon? 6 carbon. Yes, 6 carbon. Yes, 6 carbon. So if a 6 carbon compound is connected to two molecules, that molecule must contain 3 carbon. So 6 carbon compound is connected to 3 carbon compound pyruvate by glycolysis, and energy is produced. 7 ATPs are produced. Even if you don't remember, it's okay, I will discuss this glycolysis. Then this, after this glycolysis, aerobic condition. Yes, I draw like this. This is mitochondria. This is mitochondria. So if I ask you, glycolysis occur in cytosol or mitochondria? Yes, outside the mitochondria, that is occurring in cytosol. Okay, pyruvate enter the mitochondria. Pyruvate enter the mitochondria with the help of H ion. H ion. Akela, don't go alone. It says H, please come with me, I will go with you. I don't want to go alone. Yes, but I don't know what is the fate of my inside the mitochondria. At least you come with me. Hydrogen say okay, I am very habitual, yes, to enter the mitochondria. Now I will take you. Pyruvate enter the mitochondria. Pyruvate is converted to, pyruvate is having 3 carbon, is converted to 2 molecules of acetyl coenzyme. Yes, because 2 molecules were there, 2 molecules entered, 2 molecules acetyl coenzyme. If I ask you how many carbon atoms are there in acetyl coenzyme, please do reply. Yes, how many carbon atoms are there in acetyl coenzyme? Acetyl coenzyme is having 2 carbon. Okay, having 2 carbon. Yes, now this acetyl coenzyme will enter the, I took different color and you will appreciate the reason of this. Yes, very good, Anik. Yes, yes, the group name is Psychiatry Biochemistry for Next by Dr. Ankur Jain. Okay, I will send on the chat. Okay, don't worry. This is Krebs cycle. Krebs cycle. Yes, this is Krebs cycle. So Krebs cycle, I take different color. Reason you will appreciate shortly. Okay, so acetyl coenzyme enter Krebs cycle and produce energy. So this is one function of glycolysis. Sorry, carbohydrate. One function of carbohydrate, and prototype of carbohydrate is glucose, that is energy production. So one function of carbohydrate is energy production. Clear? Second function of carbohydrate, yes, second function of carbohydrate, I will write differently. Yes, means color would be same, color would be same, but at the apex, like this, I made this like this. Yes, I make like this. HMP shunt. This is just like a hump. जैसे ऊँट का हम्प होता है, yes, this is like a hump, HMP shunt, okay, HMP shunt, okay. Just to have, it is a weird thing, but no, but sometimes it develops, yes, spontaneously. I am habitual, yes, and I want my students also to be habitual, okay. HMP shunt, that is hump, okay. HMP shunt produce, yes, NADPH. Sorry, I should take the same color. I should take the same color. What is the importance? You will appreciate shortly. Yes, HMP shunt produce NADPH. Okay. What is NADPH? What is NADH? What is FADH? Yes, in the corner or at any place, not here only, okay, at any other place you will write, just to, yes, integration or means basic concept, NADH, FADH, NADPH. NADH produce 2.5 ATP, FADH produce 1.5 ATP, NADPH produce how many ATP? Yes, please do reply. NADPH produce how many ATP? Yes, no ATP, 0 ATP, 0 ATP. The function of NADPH is reduction. The function is reduction. The function is reduction. Wherever you want NADP, yes, whenever you want reduction, you will use NADPH. You all know joining of oxygen is oxidation. Good, GDK. Yes, joining of hydrogen is reduction. So NADPH is not related with energy, it is related with reduction. Means whenever we want reduction, NADPH will go and will give hydrogen and will reduce. Trust me, whatever I am telling you, these are generalized statement. I will use in multiple question. So will solve so many questions by these concepts only, okay. So NADPH is required for reduction. Wherever we want reduction, we use NADPH. Where we use NADPH, question is asked, NADPH is used in fatty acid synthesis. Sorry, I should take again, the color should be red. Why red? I will tell you. I have chosen red initially, so all the thing I am mentioning in red is activated by insulin. Yes, I will tell you, don't worry. NADPH cause used in fatty acid synthesis. When I will discuss fatty acid synthesis, at that time I will tell you that NADPH is used in fatty acid synthesis. NADPH is used in cholesterol synthesis. Cholesterol synthesis. Okay. So this is flow chart. Yes, till now we understood one function of carbohydrate is to produce energy. Second function is reducing equivalent. Reduction means you all know there is always oxidative stress in our body. Always there is production of oxidative stress, oxidative reagent. These oxidative reagent can damage our DNA, can damage our cell membrane. That's why carbohydrate is the main product which is coming in our diet. So carbohydrate, we give one more function. Okay, you will take care of oxidative reagent, make NADPH, and this will make NADPH by which shunt? HMP shunt, hump shunt. This NADPH has multiple function. It helps in fatty acid synthesis, cholesterol synthesis, steroid hormone synthesis. It convert oxidized glutathione to reduced glutathione, means reduction. means it destroy oxidative reagents, it destroy macrophages, in the macrophages it destroy the toxic stimulus also. Okay, I will tell you for the time being cholesterol synthesis and fatty acid synthesis. Now we know that our blood, so till now you know the carbohydrate function, energy production and reduction. Third function, we all know that our blood glucose is maintained. If blood glucose is high, diabetes; if low, hypoglycemia. That's why our blood glucose is maintained at normal level. Just like we took breakfast, as we took breakfast, we ate so much of carbohydrate. This all carbohydrate will be absorbed and will reach in the blood, so blood glucose will increase. But we know that should not be there. If blood glucose increases more than a particular limit, you will say the patient is having diabetes. So what is done? Liver is the main organ of metabolism. I know that I am investing time for further. Liver is the main organ of metabolism. It is the responsibility of liver to maintain blood glucose. Means when you took food, blood glucose increased, liver will take this extra glucose and will convert into glycogen. Why? Because in between meals, means from breakfast to lunch, my blood glucose is being utilized by each and every cell. Each and every cell is utilizing blood glucose, so blood glucose will tend to decrease. This may lead to hypoglycemia, but we don't have hypoglycemia. Why? Because in between meals the liver glycogen is broken down to maintain blood glucose. Means liver is working continuously. Means whenever we take food, liver take extra glucose and convert into glycogen and store. In between meals, when blood glucose is being utilized by different cell, then liver will cut this glycogen, means store this glucose in the form of glycogen, will cut this glycogen to maintain blood glucose. Again I repeat, we took food, blood glucose increased, liver take this glucose and convert into glycogen. In between meals, this blood glycogen is broken down to maintain blood glucose. That is clear. So this is about, means one function was reduction, one function was energy glycolysis. Now I take that glucose is converted to, I will write like this, converted to glycogen. And yes, glycogen and stored. Okay, now what about this broken down? I will discuss later. So one function glycogen, one function energy, one function carbo, yes, one function reducing current. But you know, nowadays cold storage is there, but previously there was no cold storage. Means if any disaster comes, means if in past, suppose there is flood, patient die of starvation, no food. So what nature thought, that when we have so much of carbohydrate, we should convert some amount of carbohydrate to fat. Nature thought that I should convert some amount of carbohydrate to fat, so that in future when there is no food, this fat will be degraded and that will be used for energy production. You all know we can produce yes, what is this? I don't know, sorry. Okay, means yes, means we converted blood glucose to fat. Why? In future if you have no food, then this fat will be mobilized from adipose tissue and will be used for energy production. So what we did, are you getting these things? Yes. What we did means nature said that one function of carbohydrate is energy, second function is HMP shunt, third function is glycogen, fourth function is that when all these things has been fulfilled, now this acetyl coenzyme, yes, acetyl coenzyme will come out of the this acetyl coenzyme will come out of the mitochondria and will take part. I draw this like this. Acetyl coenzyme come out of the mitochondria and take part in both cholesterol synthesis and fatty acid synthesis. This is stored in adipose tissue. Adipose tissue. Okay, fatty acid, adipose tissue as fat, triglyceride. Triglyceride means acetyl coenzyme. Please do, yes, please do accept this difficult part. I know that I am putting extra burden, but trust me, if you could not understand this, yes, it is useless to read biochemistry, and it's useless means you will not be able to solve complicated question or clinical question. So what we did, when energy requirement is fulfilled, when glycogen storage is full, when HMP shunt has done its work, yes, NADPH is produced. Now this extra acetyl coenzyme means energy requirement is fulfilled, even that we have so much of glucose. These glucose molecules are converted to acetyl coenzyme, and these molecules, yes, acetyl coenzyme will come out of the mitochondria. These acetyl coenzyme join to make cholesterol and fatty acid, and this fatty acid is accumulated in adipose tissue in the form of triacyl glycerol. Adipose tissue, yes, A. This is A. Clear? Now if I say you, what is the another function of glucose? 4 function we know, 4 or 5 function we know. One is, first priority is energy. Each and every cell think of energy. First priority is energy. Second is HMP shunt, produce reducing equivalent. Third is glycogen, because we will take care in between meals. Then even then, if glucose is left, that is converted to fat and stored for future. Okay. Fifth is, when blood glucose is increased, this glucose go to pancreas. I draw pancreas here, go to pancreas. Beta cell, and glucose is this glucose release insulin. Yes, you all know that pancreas is sensitive to the concentration of glucose. Whenever blood glucose concentration increases, pancreas beta cell release insulin, and insulin wants that whatever pathway I have done till now, they should be activated so that we can clear the blood glucose. Otherwise blood glucose would be high, and that would be diabetes. So nature has planned that whenever blood glucose will increase, this blood glucose will go to pancreas and will release insulin, and this insulin, let me take this red color, insulin, yes, this insulin will activate, yes, this glucose will release insulin, and insulin will activate all these pathway which I have done till now. Again I repeat, yes, yes, means insulin activate all the pathway. It activate HMP shunt, sorry, yes, it activate HMP shunt, it activate fatty acid synthesis, it activate cholesterol synthesis, it activate glycolysis, it activate glycogen synthesis, glycogen. So no need to mug up, no need to mug up which pathway or which is catabolic enzyme, which is anabolic enzyme, which is activated by insulin, which is inhibited by insulin. No need. Just remember, insulin want that blood glucose should be decreased. Yes. Why? What I write? I write here. I write here. This is a very, very important mnemonic. Yes, I write here. You will also write on the top of the page. Yes, I have taken which color? Red color. So I take red color. Yes, main capital, main function of insulin is to decrease blood glucose. Main function of insulin is to decrease blood glucose. Yes, what is main? M A I N. How many letters? 4. 1, 2, 3, 4. Okay, so I say glucose transporter 4. 4. Just a mnemonic. Okay. But this statement is true every time. Insulin has only one and one thing in its mind: to decrease blood glucose. Any pathway which decrease blood glucose will be activated by insulin. Now, if we utilize glucose, definitely blood glucose will decrease. So if I divert, okay, if I divert this glucose towards glycogen, blood glucose will decrease. If I divert glucose to the glycolysis, blood glucose will decrease. If I divert pyruvate to this acetyl coenzyme, blood glucose will decrease. If I divert this glucose towards HMP shunt, blood glucose will decrease. If I divert extra glucose to fatty acid synthesis, cholesterol synthesis, blood glucose will decrease. So all these pathway, they are rate limiting. Is I will definitely reply of that question, non-academic question, definitely. Yes, we will take care of that. Don't worry, dear. Okay. Yes. So all the pathways which decrease blood glucose are activated by insulin. So all pathways, when I will discuss the rate limiting enzyme of glycogen synthesis, is glycogen synthase. It is activated by insulin or inhibited by insulin? Activated by insulin. Okay. Now, main function, M for muscle. M for muscle. Muscle may be cardiac, it may be skeletal. A for adipose tissue. Insulin increases glucose transporter 4 at these, yes, tissues. Means, yes, question is asked, where glucose transporter 4 are found? Yes, cardiac, skeletal muscle, adipose tissue. You will remember this main function, glucose transporter 4, M4 muscle, it may be cardiac, it may be skeletal, A4 adipose tissue, IN4 IN4 insulin, and its function is to decrease blood glucose. Now everything outside this mitochondria is cytosol. So if I ask you, HMP shunt occur in mitochondria or cytosol? HMP shunt occur in cytosol. Glycogen synthase occur in cytosol. Glycolysis occur in cytosol. Fatty acid synthase occur in cytosol. Cholesterol synthase occur in cytosol. All these pathways occurring in cytosol. No need to mug up. Yes, just remember this flow chart and you will, yes, I will extend this. Don't worry. I will complete the whole metabolism on this. Before that, yes, I will discuss individual pathway one by one and their clinical relevance. Yes, how questions are asked, and then I will merge on the same flow chart. Just for the time being, lipid come from diet. Lipid synthesized in our body. Yes or no? Lipid, two sources. One from diet, which is coming from diet. That lipid is called exogenous. Yes, I take same color, exogenous, which is synthesized in our body, triglyceride, that is endogenous. Means fat which is synthesized in our body, that is called endogenous, this one, and which is coming in diet, that is called exogenous. If I ask you, I am giving you fat, which fat you will prefer, triglyceride or cholesterol? You will say, sir, please give us triglyceride, we don't want cholesterol. So nature kept in mind that cholesterol, extra cholesterol is dangerous. So nature said that whatever lipid you are taking, in which majority is triglyceride. What is the color of cholesterol? What is the color of cholesterol? Please do reply. Color of cholesterol, I have told you. Color of cholesterol. I will take a break after this. Yes, just to take you how we can make mnemonic by the color, by the smell, by the taste, by the physical property. Yes. Orange, gray, yellow. And what is the color of butter? Triglyceride, that is white. Yes, I have given in your handouts. Yes, look at this. I will take break after that and will then complete the remaining part. Just to tell you, orange, good. And this is white butter. White butter is triglyceride. Cholesterol is orange. Yes, and cholesterol is round orange, and white butter. Yes, you must have heard many times from your parents that यदि बटर दानेदार घी बड़ा अच्छा होता है. क्या दानेदार घी है? Means that is granular. If I implant this granular subcutaneous, if a person is having very, don't write, just understand the feeling I am telling you, giving you, that how things are related and can be connected with our daily life. Whenever triglyceride is increased, means you will say this butter is increased. When this butter is increased, white butter is increased, it will deposit at different place. If it deposits subcutaneously, yes, subcutaneously, danedar ghee, yes, that is eruptive xanthoma, eruptive, छोटे दाने, small granules, eruptive xanthomas. If this laddu, that egg yolk I say, this is laddu goal, circular thing, if you Yes, this is a weird mnemonic, I know, but I do that, and I found that it is really helpful to remember different. If I take this cholesterol, I extract this, I take this and implant this cholesterol at tendo Achilles subcutaneously. You must be feeling that what weird thing I am telling you, but please do accept for the time being, and you will really appreciate in later part of your preparation. Yes, I inject it or implant it subcutaneously at tendo Achilles. You are feeling, if you are seeing this picture, you are feeling just like you have implanted that cholesterol here, and you must be having feeling that you have implanted this granular ghee here. So whenever triglyceride is there, they are increase in body, there is eruptive xanthoma. This is called eruptive xanthoma. Erupt कर रहे हैं, eruptive xanthoma looks like this. And whenever cholesterol is increasing, there is tendon xanthoma, and most common site is tendo Achilles. So even if you have an image of a particular compound, you find so many correlation. So if given and I ask you which compound in this patient, which lipid is increased in this patient, please tell me which lipid is increased. Cholesterol. Yes. Eruptive xanthoma. Yes. Which lipid? Triglyceride. And what is the color of triglyceride? White. If you take sample, a person is having very high triglyceride, then you take sample, the color of blood is red, and the color of triglyceride is white. Color of tomato soup is red, and color of cream is white. So when you take sample, then you find, yes, cream of tomato soup appearance. Multiple type question, clinical question. A person taking sample and the sample color is cream of tomato appearance. Then which lipid is increased? Triglyceride. If you took sample, you separated plasma is having triglyceride. What would be the color of plasma? Would be the color of plasma? White. Plasma color is white. Milk is white. Milk word is also used lactation. Lactescent blood, lactescent plasma means you took sample, white, milky white plasma. Which lipid is increased? Triglyceride. If you take sample of this person having high triglyceride, you kept in refrigerator overnight. In the morning there is supernatant, above there is white layer. This is that typical triglyceride. Butter floats on the buttermilk. एक चुटकुला भी सुना हो तुमने हिंदी, sorry for those who can't understand Hindi. Yes, कि एक बहू थी, वो दूध बटर निकाल रही थी, ओके, तो मक्खन, तो उसके ससुर का नाम मक्खन लाल था। तो बहू कहने लगी, सासू माँ मक्खन आ गया है, क्या करूँ मक्खन का? सासू कहने लगी, बेटी तेरा ससुर का नाम मक्खन है, ऐसे नाम मत लिया कर। नेक्स्ट डे शी वाज डूइंग दैट एंड बटर ऊपर आ गया, मक्खन। तो बहू बोली, सासू माँ ससुर जी छाछ पे तैर रहे हैं, कहाँ निकालूं? सो मीन्स बटर इज़ वेरी लाइट, it remain at superficial, supernatant. Okay, so supernatant layer of white, lactescent. Yes, which triglyceride is increased? Which lipid is increased? Triglyceride. If triglyceride is so much, you do fundoscopy. In fundoscopy, when you will see there is reddish hue, pinkish hue, because the blood vessels are there, retina में blood vessels होती हैं, blood vessels are there, they give pinkish hue. But if triglyceride is there, hypertriglyceridemia, then it is white color. the hue will change to blood vessel will be loaded with triglyceride. This will be changed to white. Lipemia retinalis is due to whitish color. So even you don't know anything about any means topic, and you know the color of triglyceride, you will solve many questions. If you know the color of color and shape of the cholesterol, this is not the exact shape of cholesterol, but we made ourselves deliberately. So I have given the introduction how we will proceed. Yes, we have 3 days. Definitely 3 days for biochemistry is sufficient, and we will learn biochemistry with these types of mnemonic and concepts. So we take a short break. You must have enjoyed the session. So we will continue after a break of 20 minutes. Okay, dear.